Hello, I'm Fernando Valenzuela, and today I will talk about the relationship between the oral health and psoriasis. We know that in psoriasis, we have an aberrant inflammation response, a dysregulated angiogenesis, and an abnormal proliferation and differentiation of keratinocytes. And we also know that 40% of patients can develop at least one comorbidity, including cardiovascular, metabolic, joint-related, and other types of diseases. However, psoriasis and oral cavity, it's still a little bit confusing. We know that we have some findings in oral and lingual mucosa. We know that there is an association between psoriasis and periodontitis, as you can see here. And we also know that the severity is often proportional to the extension of the skin lesions, such as fissurating tongue, and this might be disfigurating. When we have a look at what's the information we have on PubMed, we can see that some authors have found there is a greater occurrence of geographic tongue, fissurated tongue, and candida infection. In some other authors, they have described there is a higher risk of candida, especially in patients who are in immunosuppressive therapy. And we also know that there is this link between periodontal disease and psoriasis. Let's see some of the manifestations of psoriasis in what we can see on the mouse. We can see geographic tongue, fissurated tongue, the periodontitis, and candidiasis. So our group first started to take a look at the oral mucosa in patients with psoriasis, and this was our first publication. And we saw there is some manifestations, and they're very different. We saw some macules, tumors located on the tongue, on buccal or labial mucosa. They were red, violet, different size, etc. We can see here some of the fissurated tongue in patients with psoriasis. We also can see here mucosal erosions and pigmented lesion in patients with the disease. We know that geographic tongue is one of the most common oral manifestations of psoriasis, and it's supported this link in histological and genetic similarities. And we can see that there's some HLA expressing in both conditions, and also histologically, psoriasis and geographic tongues are very, very similar. So next, we went to other patients with psoriasis, and we saw if they had or not periodontitis. And basically, we have patients with psoriasis, and we compared them with healthy individuals, and you can see that the number of teeth and the frequency of toothbrushing or dental floss use are different, and patients with psoriasis have less total teeth, and they used to toothbrushing in a different way, and they usually don't use dental floss because of the bleeding. I think that they are afraid of using these things. So basically, they have a diminished number of teeth, but also they have a moderate and severe periodontitis, and this is very different compared with the oral healthy patients. And so we can see here the characteristic of the psoriasis, but also the periodontitis, and especially the higher risk of severe periodontitis was in patients with moderate to severe psoriasis. So it's important that we evaluate the health of the mouth of our patients and recommend preventive strategies for maintaining their oral health. But we have some challenges and opportunities because nowadays our diagnosis and treatment of psoriasis is based only in the things that we can see. And this is not an issue for us because we're dermatologists, but for the non-specialists, it's kind of difficulties. So we have delayed in the diagnosis, the progression of the disease, the comorbidities and cost, the treatment response and the quality of life of patients basically diminished. And we have some unmet needs, new diagnostic tools, and especially safe and non-invasive ones. We have some biomarkers in psoriasis, and this is one of the main studies where we can see that a lot of genes are connected with biomarkers, and some of them are emerging, but we still have a very few studies. But we have challenges. There is no specific biomarkers for psoriasis. We have also biomarkers which includes invasive blood or skin samples. So it's poorly tolerated by patients and demands highly trained professionals for the collection. And also there are some challenges with the biopsies, basically because it's costly and time-consuming process. So our group decided to investigate and to find new ways to help this issue. So we went to see the oral biomarkers of psoriasis in oral fluids, and we find there is some salivary biomarkers. The saliva showed differences, increased levels on TNF-alpha, interleukin-1 beta, interleukin-12, and interferon gamma, for instance, and a decreased levels of interleukin-10. And there was a positive correlation between interleukin-1 beta levels and the psoriasis activity. However, saliva has pros and cons. Pros is a non-invasive way to discover and to analyze biomarkers. It's easy to obtain, it's cost-effective. However, 98% of saliva is water, so there is a lower concentration of analytes, and it's affected by the oral status. And there is no standardization in collections and analysis. So we started to think other ways to have biomarkers, and we find the gingival crevicular fluid, and we can analyze it by this little paper, and it's very easy. The composition of GCF reflects exactly what's happening in serum or blood plasma. There's a very low risk of contamination with food, and the collection is quick, safe, and it's not invasive. So it's very easy to collect, and we have found higher amount of some molecules such as GCF, S108, and we will discuss some of these in a minute, because it has been the work of our group in the last years. First of all, we went to see what about the interleukin 17A, 22, 23, and S100 protein family in gingival crevicular fluid of psoriasis patients compared to healthy donors. And we can see that there is higher levels of S100A8 in psoriasis patients compared to the controls, regardless of periodontitis. And also S100A8 levels were associated with psoriasis severity. Then we went to find interleukin 18 and E-selectin levels, and it was associated with psoriasis. So both of them could be potential biomarkers of the disease. And then we will take a look at BEGFA and patients with psoriasis. And again, psoriasis and severe periodontitis were associated with GCF levels of BEGFA in opposite and independent weight. So in patients with psoriasis, the higher the psoriasis severity, the lowest the BEGF-alpha in GSF. So in conclusions, the use of biomarkers will help to overcome the limitations of our diagnosis and treatment of psoriasis, and the oral cavity represents a very good source of biomarkers. The gingival crevicular fluid, it stands as a reliable reflection of blood plasma, having a low risk of contamination, It's easy to obtain and it's painless. So our group is working on identifying biomarkers and in this area. This is Dermoral, our research group. Here we have dermatologists, but also dentistries and a multidisciplinary team. And I think that we will find new things to share with you in the future. Thank you so much.